I mentioned earlier, and I wanted to make sure I gave full credit, we were sent a chart by Senator Jeff Flake's office. His staff put together a chart county by county in the state of Arizona, what families, what individuals, what couples and families would pay in 2016, and then what that family cost would increase to in 2017. And then just to show you how ridiculous these costs are, they mirrored that next to the average mortgage in every county in Arizona. And it is absolutely staggering what this is doing. So joining us now on our Newsmaker line is Senator Flake. Senator, thanks for jumping in so late in this on such short notice.
Hey, thanks for having me on, and thanks for putting that chart out.
It's unbelievable. We've already had it shared about 40 times in less than 30 minutes. I'm getting more reaction from people about this specifically than anything we've had in a long time, because I don't know of a family that has $800 just sitting around that if you increase their insurance cost or any cost by $800 a month, they can just pay it out of hand.
Right. Well, if you look at this chart, what it shows people, it's tough to kind of quantify all this and have it sink in how much you're paying for health insurance. It keeps going up. And so if you could compare it to your mortgage, then that's a good way to see where we're going here. And if you if you're a family with 2 children, age 40, say in Maricopa County, the average premium, and this is for the silver plan, which is the second cheapest plan, is $1,500, just over $1,500. Your average, the median mortgage is just over $1,000. So
yeah.
you're paying almost 50% more for your health insurance than you are for your mortgage.
And watching these increases, what really are staggering to me is what people are paying in increases. It's Apache County for the family of 4. It's a $900, just under $900 increase. It is over $900 in Cochise. It is a $900 or just under that in Coconino County, Gila counties. I mean, it's just staggering that people are paying an average of $900 to $1,000 more per month. I got an email from a woman who says she's an insurance broker that said under the plans that they're talking about now, her insurance costs are going to go up to $2,777 for her family, and her deductible is over $13,000.
Oh my goodness! Yeah, this is we're only talking here really about premium increases.
Right.
What really hits you is when you go and try to utilize your insurance. Then you find out what your deductibles are. You find out what your copays are. And in many cases, it makes no sense to even try to draw on the insurance. This is so pricey. It's just priced everybody out. It really has. And the government's response, the Obama administration's response is, well, consumers aren't, in most cases, paying that much because depending on your income, you're subsidized by government. Well, how long is that going to last?
Right.
Believe me, this model simply isn't functioning. It's not working, and it's in really a death spiral. It really is.
So what is the answer? For the next session of Congress, no matter who the next president is, what can Congress do? What will Congress do? Because the American public, the economy of America is going to be hammered by this. So what will the Congress do?
There are a number of things. One, I've introduced legislation to simply allow individuals to broaden their HSA. If we're going to have high deductibles, then allow people to go ahead and utilize the kind of coverage they need. So we would extend in perpetuity some of the exemptions that have existed. For example, a single person who simply couldn't find affordable Obamacare coverage. What we've got to do is make sure that people can find coverage outside of Obamacare, and they can't currently. That's the only game in town, because if somebody drops you, and a lot of people have been dropped by their insurance, the only thing there is Obamacare, because they have to get right now a plan that is compliant with Obamacare, and that means it's expensive. And so people need to take advantage of exemptions that currently exist. They have to be extended in perpetuity, and make use of health savings accounts on a broader basis, and to be able to purchase insurance across state lines that would lower the cost considerably.
Now, what are the chances that any of those things can and will happen in the next session of Congress?
I think they're good because no matter who's in the White House, Donald Trump has said that he would repeal or try to repeal on the first day. It would have to be Congress that did it. But if Donald Trump is in, obviously we would have both a Republican House and a Republican Senate, and we could move forward with what we've been trying to do. Second, if Hillary Clinton is in the White House, Obamacare is not called Hillary Care. She may wish it is, but it's not, and she doesn't have the same devotion to it. And believe me, there is nobody in the White House that can withstand these kind of increases politically. And so they're going to have to be working with Congress to actually fix it. So it was completely unrealistic to think that Barack Obama wouldn't veto something that we put on his desk, and we did, to repeal Obamacare. But Hillary Clinton, it's a different ballgame.
Yeah, he is out on the stump now defending it. Didn't he have a conference call the other day with 25,000 supporters and volunteers telling them to go out there? The media is not going to help us, but extol the virtues of Obamacare. He's still trying to sell it to the American people, and I just don't think when it begins to hit their wallets that there's going to be any way you can defend it, because people will feel it and know that no matter what they're saying is just spin.
Well, the only reason it hasn't completely come to a head yet is most people still have insurance through their employer, and they're not forced into Obamacare yet. Members of Congress are. I'm not on the Arizona exchange. I'm on the D.C. exchange, but we've had massive increases in premiums and co-pays and deductibles. But as more people lose their insurance or move and not have insurance, move jobs, then they're feeling it. Or if they have Obamacare and go and actually try to use the coverage they have and find out how high their co-pays are, then they get upset. And so it simply is not sustainable. It's not.
Well, if people want more information, I know your office, this chart, this is such a simple example in this chart you put together, in which we appreciate. If there a place that you know of that people can go to find out more information on this?
You bet. You've linked it on your site. You can go to my site, Flake at Senate.gov, or just Google in Jeff Flake and go to my official page, official website, and we'll have the links where you can find out more information on this. And there are a number of groups out there that have analyzed this, Cato Institute, Heritage, and others that will look and tell you what these increases have been and where we're going. So a lot of places, fortunately, to get information now.
We certainly do appreciate the information because, like I said, this is one of those things that really we've gotten more response from this than just about anything we've done in a long time. So I want to make sure people can get more information, and let's get it out there. And as always, we appreciate your time when you're able to come on with us.
Hey, thanks for getting the word out.
All right, thanks a lot. That is Senator Jeff Flake and his office doing a great job of putting that chart out that we've shared on multiple social media platforms, and we'd like you to share it as well. Information is the key on all of this. This is not rhetoric. This is actual data of what it's going to cost right here in Arizona for health care, which is one of the most important things for families in Arizona and everywhere else in the country.